Hi, this is Dr. Rohan Dedhia from Ojas Hospital. Today I'll be talking to you about cataract surgery and who is more at risk of developing the same. Cataract is something which is now becoming a common problem that is afflicting one and all. It is something that we're all physiologically prone to develop. Just as your hair turns gray with age, likewise the lens inside your eye, which is transparent at birth, as you age tends to become more and more cloudy. And this clouding of the lens is what we term as cataract. Age is one risk factor which will bring a cataract about. For patients who have general health issues like diabetes mellitus, if the diabetes is not very well controlled, cataract can develop at an earlier age. Another risk factor here is steroid use. For patients who are using steroids for various other conditions are predisposed to develop a cataract at a younger age. Trauma is another risk factor wherein blunt or penetrating trauma in the form of a ball injury or a stick injury can change the dynamics in the eye, which can predispose to a cataract developing earlier than one would expect. For patients who have refractive errors, high refractive errors like myopia, where you have a high minus power, such patients tend to develop a cataract at a younger age. So we need to screen patients who have high numbers for the same. Cataract is not something that is only restricted to the elder population. There are also children who present to us with cataract. These are termed as congenital or developmental cataracts, and the patient will present to us with a complaint of difficulty in seeing. So if you have or you know anyone who is complaining to you about decrease in vision, you should bring them in for a regular checkup and we can screen them for a cataract.